I don't know that much about Endolift. Well, I do. I mean, I see it, but I don't know that much about it. So I'm really intrigued to know, like, seriously, like how it works
Yeah.
and things like what type of patients it's useful for, how the technology
Yeah.
works. Yeah, tell me a little bit about it.
So it is a remarkable tool for debulking periods of stubborn fat on the face, but more
Yeah,
importantly, tightening and lifting the face. So
amazing.
we do a lot of injectable treatments, and you can do some amazing things with injectable treatments,
Yeah,
restoring volume, adding definition, shape, structure, support, all these different things. But there's some certain parts of the face, particularly the lower third, where we often generate a lot of laxity as
yeah,
time goes on. These early signs of jowling,
yeah,
a little bit of stubborn fat under the neck, where we could really do with a bit of a lift, but a lot of patients quite aren't at that stage where they need a full-on facelift
yeah,
yet. You know,
yeah,
sort of that age range of like say 40 to 50, where we've got a little bit of laxity that we'd like to address,
yeah,
but we're not quite at facelift stage
yeah,
quite
yeah,
yet.
yeah,
Perfect though for those types of people.
yeah. And we see it like in the 20s as well.
You do,
Stubborn
yeah,
fat that just doesn't go. Like, a lot
100%.
of patients have it, and it's not through aging. It's
No.
just that it's their natural anatomy. So really good for those patients too, right?
100%. Purely, a lot of the cases are purely genetic. You know,
Yeah,
a lot of these patients are built like this. They're
yeah,
super skinny.
yeah,
They've just got that stubborn
yeah,
pocket of
yeah.
fat. Their mum's got it, or their
So
dad's got it.
common
It's
as
just that it
well.
runs in the family.
Yeah,
Yeah, and it's you've got different ways of dealing with stubborn fat in the face. I'm not a huge advocate of doing fat dissolving
yeah,
injections. I don't know
same.
if you are.
I've never done them.
You've not,
I,
yeah,
I haven't, because I've seen so many
yeah,
bad side effects with them: delayed healing, swelling,
yeah,
irregularities.
exactly.
You don't get that with Endolift, right?
No, no,
Yeah,
it's the debulking part of that procedure is orders of magnitude more than what you would get from
yeah,
any fat
yeah,
dissolving injections.
yeah,
And actually, with fat dissolving injections, right, you need to have quite a few of them before you see any sort of
yeah. Of course.
visual change.
Yeah,
And by the time you paid for a course of like 3 to 6 acrylics dissolving injections, you're looking at the price of an
yeah,
Endolift anyway.
yeah,
So, and if you're weighing up whether you do one or the other, it's a complete no-brainer.
yeah. Of course. Yeah,
But you've got kind of like, injectables, fat dissolving injections. You've then got energy based devices.
yeah,
In terms of dissolving fat or melting fat, I would say Endolift is probably up there with one of the most effective devices on the market, because you are getting right into the fat itself with
yeah,
the fiber, and that heat from the fiber is just directly melting the fat
yeah,
essentially. But the other important thing is, when you're debulking the face, you have to tighten the skin at the same
yeah,
time,
yeah,
because a lot of people I've seen before will come in and they've had liposuction, for example, on their neck,
yeah,
and they, for whatever reason, they haven't factored in any skin tightening at the same time,
yeah.
and they're left with a sort of loose
Laxity.
turkey neck.
Yeah,
So
absolutely.
the other great thing about it is it doesn't just get rid of the fat. We're able to quite powerfully tighten the skin at the same time
It's
in order
incredible.
to get the best results. And obviously, the step above something like energy-based devices would be liposuction or something
Yeah,
like that.
yeah,
But
yeah,
again, it's quite an invasive procedure,
of
and
course.
quite a lot of people don't have enough fat to warrant that
Yeah,
much of invasiveness of a procedure
yeah,
like liposuction. So it's a great tool, and it kind of bridges that gap, I always say, between the limitations of what injectables can achieve, both with dissolving fat and also tightening and lifting the skin.
yeah,
There's great biostimulatory injectables like Jolene or
yeah.
Radiesse and things like that. However, you do the tightening you get from an energy-based device like Endolift is much
So
more
much more.
significant.
Yeah, of
It's not
course.
really comparable. And quite often, what we will actually combine those two treatments.
Yeah.
We'll fling in a biostimulator 6 months after the
Yeah.
procedure. But yeah, very very powerful for getting rid of layers of stubborn fat. So this
Amazing.
is a little fiber here.
I can't believe how small that fiber is.
It's tiny. It's
So people are always going to think, like, is it going to do damage? They can see it under the skin, this little red light, but they don't know what it is.
yeah,
Looking at that, I mean, it's so tiny.
it's really tiny.
Like, it's not going to cause any trauma to the
No.
tissues, is it?
Not at all. It's actually a very safe procedure,
Yeah.
because we're not going deep enough to impact any of the significant facial nerves or blood vessels or arteries or anything. They sit quite deep in the face.
Yeah.
And so we are going quite superficial with this little
Yeah,
thing.
okay.
And it basically, at the end of this is a little laser, and I think it's 1470 wavelength,
Yeah.
which basically is targeted towards water.
Okay. Yeah.
So it heats up the tissues, and depending on the setting you want to do, you can either melt fat or tighten the skin.
Yeah.
Depends on how much energy we release through the laser,
Okay.
right?
Yeah.
So, for
Makes sense.
example, if we're looking to melt fat, you want to increase the energy level to about 3 to 4 watts.
Okay.
And the other setting, which is really important with the Endolift procedure, is what we call the T on and the T off of
okay.
the laser.
Okay.
Right. So that T on is how many milliseconds the laser is on, and how many milliseconds is the T off is how
Right,
many
okay.
milliseconds the laser is off.
Okay.
So when you hear the machine, you hear it beeping as it goes through.
I hear the beeping.
You hear the beeping. You hear it to the room
I
next door,
do.
don't you?
I hear the beeping next door.
I've turned it down so it doesn't bother you as much anymore. I was getting some complaints about the old beeping. But if we're looking to melt fat, we want the laser to be on for more time than the time it's off.
Yeah.
So we'll put it on, say, a power level of, say, 3 or 4, with a T on of, say, 70 milliseconds and a T off of 30 milliseconds.
Yeah.
And that way the tissues are being heated up more with
Yeah.
that energy level setting. Okay. If we're tightening,
But not heating too much
No.
that it's causing damage.
no. So when we're heating tissues to melt fat, it's just about 60 degrees, just above 60 degrees.
Yeah.
So it's not enough to cause any fibrosis or
Yeah.
any permanent damage to the skin. It's
Yeah.
just enough to just sort of melt those fat cells.
Yeah.
Okay, without
Yeah.
causing any damage.
Amazing.
That's one thing actually that's quite important. You've got a lot of fake Endolift devices on the market at the moment.
There's a lot.
Actually,
A
yeah.
lot.
I'll talk about that in a sec. 'Cause I feel
Yeah.
like I'm going to go on a tangent with
Yeah.
that. But heating up to about 60 is good for fat melting, and then when we're tightening, we lower the energy level. So the watts is about 2.5 to 3 watts.
Yeah.
And a powerful combination is just a 50-50 T on, T off. So 50
Right, okay.
milliseconds on, 50 milliseconds off, T on, T off.
Yeah. Okay.
That's really powerful for tightening.
Right. Okay.
And we simply pass it back and forth under the skin.
Okay.
These certain vector patterns coming down in this direction. And we have several different entry points per area of the face. Because if you can imagine, the fibers kind of fanning in a fanning
of course,
technique.
Yeah.
So where the entry point is, that area is going to get quite significant energy because the laser
Of
fiber is
course, it's
coming back to that
each
entry
time.
point.
Yeah.
Yes.
Yeah. Similar as when you're placing filler. You need to
Exactly.
be careful not to put too much filler at the
entry point.
End point. Yeah.
Exactly.
Okay.
So this is where things like how the procedure is done and your
that's
technique
interesting.
comes
Yeah.
into play,
Yeah.
because you don't want to put too much energy in that
Or you
single
get dips,
area.
I would imagine.
Exactly. Yeah.
Dips of
that's
fat.
exactly
where there's
what
been too much
happens.
fat deposition. Yeah.
Yes. And so you various different entry points covering the same area,
Okay.
just in order to minimize the amount of energy that's placed in that one entry point. But we
Sounds
sort of
good.
come down in these different vectors in the face, and the idea is that we try and create retrograde
Okay.
lift up in this direction. But the little fiber, when we're tightening, just passes just under the skin, and then it kind of heats up the tissues.
Yeah.
And you will have some initial skin contraction, which you can feel straight away.
Yeah.
Like, it's quite remarkable in some cases. Like, we'll treat one side of the face, and if you pinch the skin, it's often you can't even pinch it with two
Really?
fingers. Yeah. And then if you pinch the other side, it's coming all the way
You
up
feel
to
it
here.
really lax. Yeah.
Straight away, you can see a
That's
result.
amazing.
It's amazing. And then you have a little bit of swelling that kicks in
Yeah.
for about like 5 to 7 days.
Okay. It's not too bad.
No. It's not enough to warn you not to go to work
Okay.
or go out in public
Yeah.
or anything like that. You know, it's not like these
Because
other...
there's no superficial changes. It's all, yeah. Okay.
Exactly. So that's the other beautiful thing about Endolift. It's you don't really have to take any time off.
Yeah. I mean, I've seen the patients coming out your room and they don't look
No.
crazy. Not like
No.
when they've had like a deep laser or anything more severe, even like a peel, skin peel.
Yeah.
You know, they're
Yeah.
walking out back into normal life and
Yeah.
they look like themselves.
100%, and that's because we did a lot of research because I was trying to look for something that could achieve this sort of tightening
Yeah.
effects that was non-surgical, that we could combine with our injectable treatments in order to take our results up to the next level. And there were some other treatments on the market, you know, radio frequency microneedling. I'm not sure gives you that much powerful results in terms of tightening and lifting in the face.
Yeah.
Face tight, neck tight, quantum. These are quite aggressive.
Yeah. And things can go wrong, right?
Things can go wrong. Yeah, these
nerve
high
damage
energy
and-
radio frequency, nerve damage is
Yeah.
another one. Even with those treatments, there's a significant downtime. You know, there's much more downtime compared to something like Endolift. But when you get the technique right with this, you know the exact energy levels to use. The results are remarkable, and
I imagine
minimal
a
downtime.
lot of this is about kind of technique, right? And I know you guys like look a lot into kind of making sure that is perfect.
Yes.
You know, you've kind of refined that well. There's a lot of people I've seen who've had Endolift at other places where maybe they don't get that good results, and it gives sometimes a treatment a bad name. Same with laser, same with anything. A lot of it is use dependent. And so I think, like you're saying, this in the right hands, you're getting great results. And I think that's the key, isn't it? It's choosing.
It's like with anything. You could even say the same thing with injectable treatments.
True. Yeah.
You know, you're paying a premium. At the end of the day, the product is the same. The filler is the same. The reason why you're paying a premium is for the experience of the injector. And in this case, it applies more, even I would argue, with Endolift, because there's you have to do a high number of cases before you really start to get the technique, understand the tissues and how the laser sort of interacts with the tissues, because not everyone's face is the same, and you'd never do the same energy level settings or even technique on the same each individual. Believe it or not, it has to change based on the individual. So you know, you might have some people that come in and we just want pure tightening. In those cases, we'd use a different fiber, so we use a radial fiber, so that a lot of the energy goes more up towards the surface of the skin.
Okay, rather than deeper into the
fat tissues.
That makes sense.
Then you have all those settings that we talked about, right? So you've got the power setting, the T on, the T off setting, so those need to be spot on.
It's getting those parameters right.
It's not like that tightening setting is the same setting we use for everyone. You know, even those three variables are adjusted depending on the amount of laxity you have, where we have to apply the energy, whether or not we'd have to do a little bit of debulking at the same time. And then the technique also changes, you know, so you know, after doing quite a few, you kind of start to develop your own techniques. You work out what works and what doesn't work. You know, we've got our own little tweaks that we do, sort of, you know, creating a little bit of lift towards the angle of the jaw, or so these vectors that I talked about. You start to develop those on your own as over time. As you do more and more of the procedure. So there is so many variables involved. It's the fiber, it's the energy, it's the T on T off settings, it's the technique that you use, and that's why there's such big variability in terms of the results.
100%.
And you have to have done quite a few of them to really get it right. And like I said, it's never the same for each patient. It's never the same.
How would you do like an evaluation on someone who comes in? So is there specific things that is there some patients that you maybe wouldn't do that on, other patients that are perfect candidates? Like how do you look at that in clinic? Or
so that's a good question. So there's various things you look at, right? So it's exceptionally powerful for people who have mild laxity. As like with anything, some patients will come to us and will say, look, for you to get the results you're looking for, you really do need to have a face or a neck lift. Even though it's a very powerful tool, there is a limit to what it can achieve. And it's important to be realistic in terms of what the patient's desired outcome is, because we can do endolift in those patients, but you know, is it going to get them the result they want? Probably not. So it's good with people who have sort of mild laxity and they just want that little bit of tightening and lift in the face. So you know, everyone over the age of 40 has these early signs of jowling. You know, that is perfect for. So a little bit of sort of laxity in the face and in the submentum, or even in the mid face. We use it quite often.
Because I haven't seen it used much in other parts of the face, but you're using it more in those areas, aren't you? Like I've asked you about my malar bags plenty of times. It's an area that is kind of like developing. Like a lot of people maybe don't have the skill to do that, but you got the right skills and you can get good results with that as well, can't you?
It can be very effective for malar bags, actually, because malar bags is very difficult to treat.
Really
I mean, it's not an injectable that's going to get rid of, and it's not really a surgical thing that's going to get rid of like malar bags here in these lateral fat pads. It's great. It's for malar bags, and it's a very quick procedure. You just apply a little bit of local anesthetic, the actual energy placement takes about 5 to 10 minutes on each side. One thing I will say though with Mallard bags is the swelling does linger a little bit more than the rest of the face.
Yeah. But you're going to get swelling in those areas anyway, aren't you?
Exactly. And any swelling, any minor trauma, if replacing a cannula in here, there's always swelling that lingers about in this area for quite a long time. So the swelling can take quite a while to come down.
2-3 weeks?
Yeah, 2 to 3 weeks.
Yeah, okay.
And actually the results for Mallard bags, we say at least 3 months before you see an improvement.
Yeah, but it's worth it for people who've had that all their lives. Yeah. Most people can take a bit of time out.
Yeah. Exactly.
For long-term treatment,
For sure. I know we see swelling. I mean, it's not huge. Yeah. It's just a little bit of puffiness for 2 to 3 weeks.
Not too bad.
No, not at all. Not at all. But to go back to your question on how do you evaluate patients, mild laxity is good, and it can be either in the lower third, submentum, or even in the mid-face. We often use the Endolift and our full face Endolift procedures coming down in these vectors here, just causing a little bit of mid-face tightening.
Nice.
And in a lot of cases, we'll do that first before we apply any volume replacement.
Yeah.
Because you imagine if you tighten first, in order for you to get that lift and volume replacement, it means you have to use less filler.
Absolutely.
So
skin's
it
tight
makes
over
sense.
the top. It's going to be much less volumes that you need, right?
100%. Yeah. Because a lot of people want laxity. For us to get that lift in a lot of cases, you got to pump a load of filler in.
That's why we're seeing such bad filler.
Exactly.
People are trying to puff out the areas of loose skin with filler, and it just doesn't work.
The skin needs to be addressed first. And as coring's good, ultra is good for that, but we'll chat about that in a second. So laxity in the face, and then people who have stubborn fat, like you mentioned previously. So areas of the face, particularly as you age, your superficial fat pads tend to move into certain places. Nasolabial fat pads tend to come down. You can sometimes actually debulk this. Try to be very careful in terms of, big question people have is, I shouldn't be melting fat in the face, and that's correct.
Yeah, of course.
Right? You shouldn't be melting fat in certain parts of your face, but there are some places where it's fine to melt fat, where we have an overaccumulation of fat, or those fat pads have perhaps moved south. These little pockets here, we can do a tiny bit of fat ablation sometimes with a little bit of tightening. That's all we do in the mid face. But this sort of jowl area down here, this lower buccal area and the submentum, it's fine to do a bit of debulking here with tightening. Because there isn't injectable treatments. We can create more definition, a bit left and things like that with dermal fillers and bag stimulators and things like that. But you're kind of not directly addressing the core of the issue. Do you know what I mean?
Well, absolutely. Yeah, you're getting that fat deposition's pulling tissue down.
Exactly.
So it's hiding any jawline or any kind of fine line,
That's it. Yeah.
Whereas this is kind of removing the superficial layer so you can see what's underneath.
Exactly.
Which is perfect, right?
Yeah. So you're addressing the core of what's actually going on in the face from an anatomical point of view. And once you've done that, then we can look to refine things with a little bit of filler. Don't get me wrong. I mean, we can create a nice result just with injectable treatments. But combining it with something like Endolift first, is going to yield the best results for 100%. Sure. Yeah.
I'm thinking there's a lot of women who could be thinking, yes, great, we can get rid of this, but it's good for men, right? There's a lot of men who want a stronger jawline, more definition, but carry that just a little bit of excess weight. And, no matter how much weight they lose on their body, they're not going to lose it from the face. It can just be genetic. So, this is a really good instrument to use for defining jawlines in men.
And I would say the patients that I have that have the most satisfaction, that come in and go, holy shit, Dr. Tony, what have you done to my face? I look amazing. As men.
Is it really?
Yeah. I don't know what it is. Men love Endolift.
Yeah.
They have the procedure, and it's like they've got this snatch defined jawline, like this the turkey neck or the double chin's gone. They love it.
Fantastic. And you see these these Instagram posts of guys having 10 mils in their face to try and achieve those results. It was just causing heaviness, bulkiness, swelling.
Yeah.
Whereas this is kind of like their own jaw that you're just revealing, right?
Yeah. And it's there's a lot of people that will come in that are holding a lot of weight in their face.
Yeah.
Along with laxity.
Yeah.
And those are difficult patients to treat with injectables, because you don't want to put more volume in their face. You're just adding more to the
heaviness in the lower part, aren't you?
Even in the mid, some people are just heavy in their face.
Yeah.
Endolift, get rid of some of that, just do a little bit of debulking, You tighten the skin. Honestly, they can look transformed afterwards.
Fantastic.
Yeah.
That sounds great. No wonder it's doing so well.
Yes. No. So the thing is, it's such a unique device.
Yeah.
There's not really anything else that can do what it does in a lot of cases.
Yeah.
You know, even surgery doesn't debulk the face.
No, of course
not. A facelift doesn't debulk the face. It just lifts the face. You know, and you don't really do liposuction and in other places. It's really unique.
Yeah.
It really does things that you could argue no other treatment could do, actually.
Yeah. And you get a lot of people coming in saying, you know, why don't I just do a facelift? We get that all the time.
All the time, yeah.
But you're not going to get skin tightening with a facelift. No. You know, you've still got the same skin.
Yes.
You're just pulling it over and removing sections of that, so you're getting changing contour, but you're not really removing those fat pads. I mean, you can do liposuction at the same time, but recovery's so long.
Recovery's so long, and most people just aren't. Their laxity doesn't warrant them to have a facelift yet.
Yeah, they're not there. They're not there yet.
They're not there yet, but they want to do something.
Yeah,
and that's probably 90% of the population. You know, eventually, when you get to that point where a facelift is a good idea. But in that pre-facelift stage, a little bit of Endolift, and it's no contraindication if you have the treatment. If you're gonna have a facelift in the future, you can have a facelift.
Yeah, absolutely. It's not going to change that.
Not going to change anything.
Not like some of the injectables that change kind of create fibrotic tissue within the skin. You're not going to get that with Endolift.
No. And when we're tightening, the heat, it's about 40, 50 degrees. The aim of what we're doing is we're actually just stimulating the skin.
Yeah.
And what happens is the skin develops these heat shock proteins, and that initiates a whole cascade of remodeling events, which takes place over the next 6 months after the procedure.
Okay. Yeah, so it's longer lasting than just what you're seeing straight away.
So all it's doing is, you can think of it as like a mechanical biostimulation of the skin, right? The heat is just kick-starting the skin. It says, wake up, start producing more collagen, and then over the next 6 months, it starts tightening up on its own accord.
Amazing.
So we're just stimulating the skin, and because of that stimulation, the skin then produces more collagen, more elastin, and it starts to tighten up, and so you're also improving the skin from a very deep level up. You know, a lot of treatments which are also very fantastic are transdermal. They're sort of from the surface in. Yeah. But this is obviously inside out, so you sort of stimulate it from a deeper level.
Yeah. So you're not getting those surface changes that then require kind of more downtime and other risks, I suppose.
Exactly. There's some risks, you know, post-inflammatory hyperpigmentation, stuff like that. You don't really get that with Endolift because we're sort of quite deep.
You're underneath the dermis, I suppose.
Exactly.
As such, so you're heating from below. So you're not getting that surface dermal stimulation, I suppose. Like direct heat, that's going to cause PIH.
Exactly. Yeah.
Amazing. So all skin types?
All skin types.
Yeah.
All skin types. And in some skin types, African dark skin seem to yield an exceptional response to the treatment.
Oh, right. Okay.
Yeah, so there's a slight genetic factor involved.
Yeah.
Darker skin types generally tend to get exceptional results with something like that. Their skin just tends to respond very well to that heat stimulation.
Okay. Yeah.
So those patients do get.
Do you think that's because the skin's thicker, or?
Yeah, I think so. I mean, it sort of heals faster as well. I mean, that's the other thing is the results, because the heat's stimulating the skin and it's almost biostimulatory in some way. To some degree, it does rely on the patient's skin to then respond to that.
Yeah, of course.
To that stimulation.
Yeah.
And like with any treatment, even injectable treatments, there is some variability in terms of how quickly the results happen.
Yeah.
So I've generally seen patients at the 2-week review, and it's like, wow.
Yeah.
You can't believe the change. Like the tissues have just responded so well. You can just see the tightening effect. And some people need that little bit longer. Yeah. Everyone will see a good result. It's just how quickly the result happens varies, and it depends on so many different factors: genetics, lifestyle, how good's your diet, do you smoke? Smoking is a huge thing, as you know. Just tissue healing in general. So, you know, class smokers, you know, you're not going to see a quick result if you're a smoker. Your tissue healing is going to be rubbish. So there's a few factors involved. So there is a little bit of variability in how quickly it happens. Yeah. And we always say for that reason, the absolute final result is about 6 months after the Endolift procedure.
That's quite nice. So you're seeing those kind of changes occurring all over that time, which is great.
Yeah, that's what I was saying. Like, once you have it every day for 6 months, you're just going to see a gradual improvement.
Yeah, nice.
Yeah,
nice. That's what we all want.
Yeah. And then the other thing is that people love is the results will last about at least 3 years.
Yeah, good. And then you can do another session.
You can do another session. Yeah. You can even do, if you're someone that gets really good results.
In the same year, I suppose.
You can.
Yeah.
You can do another session in like 12 months if it's really done something for you and you want even more.
Yeah.
You can have another one in 12 months.
Perfect.
Yeah.
Sounds great. So it works alongside what we're doing already. Exactly. In terms of like injectables and...
It works perfectly.
Yeah.
It just falls perfectly into play. And especially when we're doing things like we do a lot of full facial rejuvenations.
Yeah.
And when you come back, those are really great, and you can really achieve amazing results with the full facial rejuvenation on its own. But then when you look at the sort of lower thirds, we have that laxity and things, and submentum in the jawline, and even if there's laxity in the midface. If you do something like Endolift first, because the dermal fillers we apply with a full facial rejuvenation just adds volume and adds structure in key parts of the face.
Yeah.
It doesn't actually tighten the skin or tighten the tissues. It's not getting rid of any areas of stubborn fat. And so if you do something like Endolift first, you're sort of improving the skin by stimulating collagen and elastin, tightening the skin, and getting rid of areas of stubborn fat. It then means when we go to add, it's a good idea often to add that structure and just refine things at the sort of 3 month mark after Endolift, because you probably still need some volume replacement in the mid-face. If you really want to get that refined jawline, a little bit of extra, small amount of fillers after Endolift. But after you do Endolift, it means you have to use far less fillers to get the same result. And we want to use as little product as possible.
Yeah, definitely.
So with all of our cases now, we're recommending if the patient warrants it, maybe do some Endolift first. Let's tighten and lift the face. Get rid of those areas of stubborn fat. After 3 months, once you've got that nice lifted, tighter result, we can then just really refine things with just really precisely placed fillers in the right areas, small amounts, and you get a really amazing natural result. And then after that, we can start applying biostimulators and all these things to really put the cherry on top of the cake.
Absolutely. Keep that simulation going.
Yeah. Just keep it going. Yeah.
Amazing.
Yeah.
Sounds great.
Yeah, it's amazing. It's an amazing device.